listening to the Chase Merrill podcast.
We both did an Ironman 70.3 last month. How'd it go for you? That was not your first. Which one was that for you?
So that was my second one. That was Jones Beach, and that was an incredible one. I finished about 18 minutes faster than what I finished in Cambridge.
Yeah.
So 2-month difference, and I'm doing 18 minutes faster. And I think that all just translated to training and understanding what happened on the first one, what I need to do on the second one. And like, I think even for you, I mean, you just finished your 70.3, and that was a big accomplishment for you. But now you're like, I know what I need to do better next time.
Oh, for sure. I have the Boulder one put up on my calendar in June for next year.
There you go.
So absolutely, because I can definitely, my transitions were super slow. Just kind of not really rushing it, just make sure I had everything. And then I was cruising on the bike. The last 14 miles of the bike though, when I got my bike fitting, they're like, hey, your seat is too wide. You should probably get a narrower seat. It's going to cause you problems. And I was like, yeah, for sure. How much are they? And they're like, oh, it's like $300 for a new seat. I'm like, I'm not spending $300 for a new seat. So I just did the seat that I had, and I should have gotten narrower because the last 14 miles, I just couldn't sit. It was digging into my bones in my butt, and it was getting so sore. So I was overcompensating by riding up out of my saddle, and then that blew up my legs for the run.
I was going to say that probably blew them up.
Yeah. So I went into the run, and I spent more than half the distance. My quads were cramping. I was just keep moving, just keep moving.
It's tough when the legs start cramping though. And you're just it's a war at that point. You're in war mode, and you're like,
absolutely.
Do I stop here? Am I going to get injured?
Yeah.
But at the same time, you're like, I got to this point. There's no way I can stop and just call it quits. And I think that's part of the Ironman journey is right, the swim starts it, and it's cold. It's early morning. You don't really want to do it in the beginning. You're kind of just like, what am I signing up for? What did I do this for? And you get through that swim portion, just about halfway through it, and you're like, I got this. I can do this. And then you get to the bike portion, and you're like, oh shit, I got 3 more hours on the bike. And in the beginning, the biking is like, oh man, this is going to feel like a very long day. And you get to that point, you get halfway through that, and you're like, I got this. I got halfway more to go. But when it comes to the running portion, the last leg, you come off the bike and you're just like, I've got to do 13.2. Yep. Can I do 13.2? You get to the halfway mark on the run, and you're 7 miles in, and you're cramping, like you said, and you're tired, you're exhausted, you're seeing people walk along the course, and you're starting to contemplate, can I finish? And I think that's where the war stories really start to come out, and it becomes more mental than it is physical.
Yeah, 100%. I remember crossing the line, and the most exhausted part is my brain just kind of melt. I let it go because I was just focused in, just on it. Just one more step, do it. And then you cross the line, and then your brain just kind of melts, and you're just like, oh, what the heck? Because you can relax.
I agree with you completely. For you, I mean, I think, what are your thought processes when you're in that mode?
Yeah, for sure. For me, like you were saying, 3, 2, 1, go. This is my first Ironman 70.3. So I'm most nervous about the swim. Not I'm comfortable swimming that far. I'm comfortable in the ocean. I've done competitive CrossFit that's had swim workouts and swims in the ocean before. So I'm used to being swimming on top of people, getting swim on top of. But it's just I'm in a wetsuit that I just rented. It was kind of uncomfortable when I tested in the pool. My shoulders were super tired when I got out. And so I was just the only time I swam was 200 meters before that in the ocean with that wetsuit. So I was super unfamiliar about the wetsuit. So that was the most nerve-wracking portion of the workout was how's this swim going to go? And then exactly right. I jump into the water. goggles start filling with water, like they were leaking. And so like I had to swim on my back to like empty them and get a good seal. And then I finally got a good seal after about 100 yards in the water, and then just head down, you're swimming. And I ended up coming out of the water, and I think at like 35 minutes or something like that, like
That's incredible.
Way faster than I was expecting. Like
That's incredible.
Yeah, it was fun. And then I got out of that, transitioned onto the bike, was pretty slow. And then for the bike, I was having a good time. Me and this one guy where he would like, I'd crush him. Like I'd pull ahead on the downhills on the straightaways, and then he'd catch me on the hills. And so we were like just talking back and forth for most of the 56 miles. And then for me, the workout started on the run. Like that's when it actually started. Like everything else was like fine, cake.
Yeah.
And
it was
then,
like, it's the run that really gets you.
And then I took like 200 steps and my quads just started locking up. I was like, oh, here we go. And I was just like, okay, they're going to relax. Just keep moving. And so like I hit like 2 miles and they relaxed for a second. And then they started a mile later, they started cramping again. And so it'd be like 2 miles of cramping, 1 mile of relaxed.
What'd you do for fuel?
Yeah. So on my bike, from my very first gel, I had a tri-suit and with like the back pocket. So I went to grab it and I accidentally like lost all my gels. So like they all came out and like shot out the back. It was brutal. So I was like, oh, there that goes.
Did you ask for any like gels or like nutrients from anyone?
So I grabbed gels and I grabbed the water bottles that they'd give on the bike transition. So like as I was like biking past, I try to grab one and down as much as I can and keep going. Nice. So I tried to compensate for as much fueling as I can. And then I did get a lot of that back on the run. Like I really over fueled that first little bit just to try and compensate for the under fueling that I got on the bike.
Nice. That's awesome, Chase.
But what was fun is we were going with my 4 siblings. And so I was like, okay, I planned to be the best on the bike out of my siblings. Like I've got a lot of power output. So I was like planning on coming across the line like 20, 30 minutes ahead of everybody else. And then my sisters are all 3 better runners. And I was like, okay, I just need a gap to make sure I can keep the lead. And I crossed the line and I'm starting in the transition. I'm running out for my run. And I'm like, where's Davis? Like, where's Davis? How far behind is, because I knew she was going to be my biggest competition out of my siblings. And my dad and everybody else they're like, she's right behind you. She's like right behind you. She's a couple minutes behind you. I'm like, how is this possible? I was holding like 21 miles per hour on the bike. I was flying. And so I ran the entire run. Just like Davis is going to be passing me in 2 minutes. Davis is going to be passing me in 2 minutes. And then finally I got a straight answer from my wife at like mile 9 of like how far back she was. And I guess there was a malfunction with the timing chip. So I was running just like scared out of my mind that my younger sister was like right behind me and going to track me down. So that ended up pushing me quite a bit harder than I probably would have if I had the gap that I thought I had.
That's awesome. That like that kind of fueled you and like that's what kept you like going and pushing harder too. And that's awesome that you did it with the family.
I mean, it was so fun.
I actually checked out your sister's Instagram pages because I saw they were twins and like they kind of have that thing going right now. And I really was interested in it and Ironmans and all that. And really, really love what they're doing as well. And they're pushing themselves studs. And really trying to be inspirational. And it's awesome.
Seriously. Yeah, they're studs. They love what they do. They love making content. They love inspiring and helping people. And they're awesome. They're so fun. They just ran a marathon today, all 3 of my sisters. So.
Oh, nice.
Yeah.
Where was that out of?
St. George.
Okay.
Mm-hmm. Cool. But what about you? What pushed you on the first Ironman versus the second Ironman, and what made you want to do a second? And I assume probably a third.
Probably a third. Probably a third. So for me, the first one was strictly proving to myself and to my body that I can push myself and I can do something that's very challenging and hard that I never would have thought about doing ever. And coming out of chemotherapy for me and coming out of a cancer diagnosis, I've been on this journey to show others that we can endure a lot more than we think, and the human body is remarkable. So for my first one ever, I was really driving that in my mindset that I need to finish, not just for me and my body, but to show others how remarkable the human body can be coming out of something so aggressive. Most people who come out of chemotherapy are kind of in limbo for years after dealing with a multitude of symptoms or health issues that arise from chemotherapy. So I kind of wanted to just drive that home on my first one to show others that it's much easier to create an excuse and play victim to this disease and fall into the system of it rather than trying to push yourself and to see what you can and cannot do physically and mentally. So, yeah, that first one was just strictly just showing myself and showing others that we we can overcome a lot and the human body is remarkable. And what drove home the second one for me was doing better than the first one.
Yeah.
But on the second one, I also had um, a relationship with a Cancer Buddy partner who I met through Cancer Buddy app, and his name is Gio, and he's based out of New Hampshire. And I met with him, and I was very inspired by his story. He's been fighting since 2022, and he's been through it the past 3 years, and he doesn't really have many people around to kind of drive home that motivation and that support. And I wanted him to see someone who came out of chemotherapy and is pushing themselves and is not giving up and isn't letting problems of the world or problems of his life dictate and narrate what's going to be the outcome for your life. And
Mhm.
I think for me, like, that second one, not only was it beating my first time, but it was kind of having that bird in my ear and him telling me to keep going, which I really appreciated, even though he wasn't actually there.
Mhm.
He was just my moral support. So for me, I felt like I constantly had him with me the whole time, and that's really what drove home my motivation to finish this race. Like, I told myself, if I don't finish, I'm gonna show him that quitting is okay, and it's not.
Yeah. That's you said you found him on the
I
Cancer
Yeah,
Buddy
so
app?
I found him through the Cancer Buddy app, which is only about 2 years old. It started in
Yeah.
2023, and it's literally meant for, cancer patients, survivors, or caregivers to kinda meet and kinda mentor or coach others through their journey of cancer.
Mm.
And it's a great way to find others who have had similar disease or have had to go through a similar process. So that's where I met him, and he actually is diagnosed with a non-Hodgkin's lymphoma,
Mhm.
different subtype of mine, and we have similar disease, but slightly different treatment paths and recovery options.
How did you ma is it like a matching process? How did you guys meet and strike a bond?
Yeah, so I met Geo. It's literally, think of Cancer Buddy app as like Tinder or Bumble
Okay, that's what I was kinda
for
thinking, yeah.
cancer patients. And Christina Merrill, who is the head of this,
Mhm.
she works with the Bone and Marrow organization out of New York, and she was trying to figure out how can she connect cancer patients to one another where they can kind of share similar stories or journeys and kind of also feel like they have someone who can listen to them and understand them. She was on Bumble one day and she was like, this is a great way to get cancer patients to kind of connect.
Mhm.
And that's exactly what she did. And she kind of took Bumble and was like, I need to figure out a way to branch off of this and make it for cancer patients. And how she made it was very simple. It's a very user friendly app, and caregivers, survivors, patients who are just recently diagnosed or currently going through treatment can use the app and find others or swipe to find others who might have the same hobbies, the same interest, maybe a similar disease. People who are asking questions about, say, medicines or
Mhm.
marijuana and how they might be doing with that. People asking questions about caregiving advice and what concepts for caregiving could be helpful to, say, a patient or a significant other to get them through a certain treatment or a certain process. So it's a really cool app. They did a really great job with it. It's still expanding. Like I said,
Yeah.
it's still a few years young, and it's growing like crazy, which is awesome. But we are seeing a lot of people who are coming to the app that are younger, which is great because we want younger people to come onto the app and kind of feel like they're not just on this journey on their own. There's others out there who can share and relate and be understanding. And when you get diagnosed with cancer, you can feel very lonesome. You can feel like you're the only one in the world dealing with it. And that's why I love this app. And I'm really happy I was able to meet Gio, make him my cancer buddy, and also bring him on this Ironman journey with us back at Jones Beach.
With Gio, what caused you guys to match with each other? Was it an interest over hobbies or the same cancer type, similar cancer type?
For me, he posted into the main discussion hub, basically just saying, he's been on this journey since 2022 and he's kind of just becoming overwhelmed with it. And it was like more of a sad post. And it made me realize that there's a lot of people out there who are trying to find mentors or trying to find someone that can be supportive or understanding. And it's not necessarily needing someone by your side 24/7. We don't need that as cancer patients. We're not looking for someone to hold our hand. At least I wasn't. But I think most cancer patients don't want to be held or spoon fed. They kind of want to be treated normal and they want to apply themselves and they want to push themselves. And I think for me, when I saw that post from him, I was a little taken back because he's a young guy. Yes, he's been fighting. Adversity is tough. But we should not be giving up on any of our challenges or battles or hardships in life. And I think that's the message I want to get across today is that we're all going to face hardships. We're all going to go through stuff in life. And it's easy to play victim. It's easy to find excuses as to why you might not be doing something or why you might not push yourself. But if everything in life was easy and there was no hardships, how do you grow and how do you take that next step to get better? So for me, I'm all about embrace the hardships because we're going to have hardships and challenges in life. You might as well embrace them, figure out how to overcome them mentally and physically. And it's never going to stop. There's always going to be another problem that arises. It's just how do you get stronger to keep going?
When did you get your cancer diagnosis? And did you have this immediate mentality when you got it? Like, were you able to recognize like, okay, this is a challenge I'm going to start and I'm going to stay focused like initially, or did you have that low point where you had to kind of develop this mentality?
That's a good question, Chase. So I would say the mentality kind of built up over time through treatment. When I was diagnosed, I was very overwhelmed. I was taken back. I was also misdiagnosed 4 times prior. So for me, I was advocating for myself for 2 years to get in, see doctors, figure out what was going on with me. And once I got diagnosed, that was a very overwhelming stage in my life because I had been fighting for so long and advocating this journey for so long. People were telling me I was wrong. Doctors were telling me I was wrong. My family was telling me that I was a hypochondriac. I had friends telling me I was wrong. I mean, it was a very big take back for me once I was diagnosed. I'm not going to lie. I crumbled as anyone would. I cried. I was torn up. It really beat me up. I was mentally depressed. I had anxiety through the roof. It was rough for me. I was going through it. I didn't know if I was going to move back to New York because I live in Maryland. I don't have family or friends down here. So I had a lot going on. I had a lot to think about. I was just supposed to get married this past year in 2024. That obviously did not happen, which is okay. I'm happy it didn't happen. But these things, I had so much going on in my head mentally between work, my health, my fiance, where things were going in life. I had a 50% survival chance. So for me, I was like really taken back. I ended up getting on antidepressants and anti-anxiety immediately. So mentally, I was not in the right headspace at all when I got diagnosed, at all. And once I got diagnosed, I really changed myself completely, starting with my diet and my health habits. And that was where the start really started to switch for me. And that probably happened about a month into chemotherapy. So I would say getting to that stage of motivation, discipline, changing my life, and really having this mindset now, it didn't happen until halfway through chemotherapy.
When you say you were advocating for yourself and you were misdiagnosed, was that like misdiagnosed in terms of like the type of cancer that you had, or people were telling you didn't have cancer at all and what was going on there?
Yeah, so to rewind it a little bit, in 2022, I was dealing with abdomen and gut issues, and I went to Johns Hopkins to go get checked out because they were issues that I've never had prior. So new issues that were kind of just subtle pains in the abdomen, groin area. And when I got checked out, I got a CAT scan done. I had an MRI done. I had an ultrasound done. I had labs drawn. Everything came back fine. The labs were slightly off, but nothing that would call for cancer. So yeah, that happened. Brushed it off. Said, I must be good. Everything came back. The doctors looked at it. And I went to a major institution, which was Johns Hopkins. So they can't get this wrong, right? 6 months later into 2022, I'm dealing with more abdomen issues now on my right side. So it kind of went from my left to the right side. Again, never had this issue before and brushed it off. Didn't think anything of it. Went on with my day. Later on, towards the end of 2022, I felt like I had a UTI. So I went to the bathroom and I went to go take a piss and I felt like I had a UTI. So I went to urgent care immediately, explained what was going on. Never had a UTI before, so new to me. And went there, explained to them what was going on. They gave me an antibiotic for the UTI. I took that for about 7 days. Didn't really get better or worse. And that kind of went away over time on its own. So after I finished the antibiotics and that cycle, and it just kind of went away on its own, which was weird to me. In 2023 now, I went to London and I woke up one morning with ringing in my left ear. It was kind of like weird ringing. It wasn't like a ringing where you like get it for like 10 seconds and then it goes away. It was like ringing nonstop, like wouldn't go away. If I put a Q-tip in there to try to see if there was something in there, it wouldn't help at all. Ended up going to the CVS of London and getting like eardrops, put those in. That lasted about 2 hours, which was great. But again, something was happening to my body that wasn't there prior, and I picked up on it. So I have a good mind to body connection, and I just knew something was off. There was not much I could do, though, because I was in London. Came back from London. I immediately went to an ENT where I got checked out. It wasn't with Johns Hopkins. It was just like a third-party ENT. They put the camera in my ear, checked it for earwax, checked it to see if there was anything maybe clogged in there or something got in. Nothing was in there. My ears were clean as could be. And I'm looking at the doctors now and I'm asking them, like, what could be causing the ringing? They have no idea. So I call my physician at this point. I'm like, I don't know who else to go to. Call the physician at this point. They're like, we can get you in January of 2024. I'm like, no shot. That's way too long. Yeah. Like, I have stuff going on. That's way too long. Called another physician. They couldn't get me in until about December. I was like, oh, man, got to figure this out. Went and got an ENT appointment on August 18th of 2023. And my other problems hadn't even arisen yet. I get to July now of 2023, and I'm dealing with night sweats, fever, coughing, a swollen tonsil, which I looked in my throat in the middle of July, and I had a tonsil that looked like a walnut almost.
Jeez.
And it had some white pus on it. So immediately I went to urgent care again, and I got checked out. They tested me for strep. They tested me for COVID. Both of those came back negative. And they were like, yeah, go to see, your physician, figure out what's going on. Call the physician again. She's like, Craig, we can't get you in until January. I'm like, guys, I'm going through it right now. Something is happening to me.
Mm-hmm.
Go to the emergency room. We don't know what to tell you. We can't get you until January. I'm not going to the emergency room. I'm not paying the money that I need to pay to go to an emergency room when there's something going on. And I went to the emergency room in 2022 and nothing even came from it. I need to see a specialist. And called an ENT again to see if they can rush up that appointment because now I have more symptoms arising. They were able to rush it up to August 12th. Thank God. I got into the ENT, which was a Johns Hopkins Network doctor, and I drove 2 hours for that appointment because that was the soonest and closest one I could get to get in at that point. He looks at me. I'm talking to him. I'm asking him questions. I'm already doing my independent research on the back end. Is this cancer? I'm asking him that flat out. He's telling me no. He's never seen cancer in the tonsil, and he's been doing this for over 10 years. Okay, that makes me feel good. I'm happy now. I'm like, great. It's not cancer. I don't have to stress it. It's something else. It's an infection. He puts this thing in my throat and it like vacuums out something out of my tonsil. And he's like, you had tonsil stones. I'm like, what is that? He's like, tonsil stones. Let me show you. Showed me what tonsil stones are. They are disgusting, Chase. Like beyond belief. Like if you looked at them, you'd be like, Craig, that's disgusting. I've never even heard of them until that day. Mm-hmm. So yeah, he's like, you're going to need about 6 months and you're going to want to do saltwater gargles with hot water. And he's like, by 6 months, you should be good. I looked at him and I was like, 6 months? Like, this is like a quality of life thing. I can't even eat properly or drink properly. He's like, yeah, I know, but like, you got to take your time. It's an infection. Your tonsil was very blown up. And I'm like, okay, all right. Leave that appointment. I immediately call another ENT that specializes in cancer at Johns Hopkins Network. Get in with him. This guy kind of blows me off because he knows that I saw an ENT a few weeks earlier. And he just thinks that I'm kind of a waste of his time, I guess. Mm-hmm. So he looks at me, looks at my throat. I ask him flat out again, is this cancer? And I'm being told no now for a second time. So this was a little bit of a step back for me, and I'm now thinking I'm crazy. I'm legitimately thinking I'm crazy, actually, because I have my family, my friends, and now doctors telling me there's nothing wrong with me, and I feel off. Something isn't right. I'm having night sweats. Like I said earlier, I'm having fevers on and off. I have a tonsil that's swollen, and I've been getting hives and rashes randomly. Mm-hmm. Doesn't make sense. Get an appointment with my dermatologist to see what's going on with the hives and whatnot, because I couldn't get into the ENT before then. So I get in with her now. She's looking at the hives and whatnot. She's like, oh, you got eczema. I got eczema now. All these crazy different health problems just kept arising, right? It was one thing after the next. I kept being told I'm being diagnosed with this. So she gives me steroid cream for the skin to help with the eczema. I start using that. It's not helping, Chase. It's not helping. I mean, literally, it was back and forth with the doctors to the point where I legitimately felt crazy at that time of my life. I thought maybe there was something wrong with me. And I get in now to the third ENT appointment, and this guy is actually listening to me. He doesn't think it's cancer, but he's listening to me. He's actually hearing my concerns. So he's like, Craig, would you be open to taking prednisone and an antibiotic? I was like, absolutely. Like, I'm trying to like fix whatever this is happening to me. And no one's given me any medicine. No one's given me any insight other than continue to saltwater gargle with hot water. So, yes, I'm going to take any medicine that you give me that you think is going to help.
Mm-hmm.
Immediately, I take the prednisone and I take the antibiotic that he gave me. Prednisone and lymphomas go hand in hand. Literally, prednisone treats lymphoma. So, he gave me the prednisone 3 days into that cycle. My tonsil ulcerated completely. Like I had a hole in my tonsil. Took a picture of it, sent it to the ENT, and was like, listen, man, this is what happened to the tonsil. And he's like, we need to get you in for surgery ASAP. And I was like, what's ASAP? He's like, January. This is September. I said, absolutely not. We're not waiting until January. I go, I will call your managers and I will tell them and voice my concerns as to why we're not waiting till January. We need to get this done in October. And that's exactly what I did. So on October 4th, I got in for surgery to have a double tonsillectomy. And I chose both of my tonsils getting taken out because I felt whatever was happening on my left tonsil might have happened on my right at any given point down the road.
Mm-hmm.
So I was like, let's just get them both out. And typically nowadays, they don't actually remove tonsils anymore. I don't know if you know that. That's not a thing anymore. Doctors will not recommend it. They actually believe you should leave your tonsils in because they're the first line of defense against infections and illness.
Interesting.
Yes, they are connected to your immune system directly.
Hmm.
So I got in, had the double tonsillectomy, and 1 week later, the pathology board reviewed it, and I was diagnosed with non-Hodgkin's lymphoma, diffuse large B cell.
Dang. How? Why do you think they missed it? Like, did they say why it took you so long to get that diagnosis?
My labs were showing nothing that would have screamed cancer. There was some slight off labs, but nothing that would say, oh, you have cancer. Like my white blood cells were 13. If you know anything about like the level of where they should be, it's anywhere from like 5 to 10 at most. At most. I think 10 might even be high on that scale. We'd have to look at that. But mine were sitting at 13 to 14, and they were sitting high for about 2 or 3 months.
Mm-hmm.
So right there was my indicator that something was wrong, infection, inflammation, something was happening to my body, but couldn't pinpoint exactly what. But that wasn't enough, I guess, to the doctors to kind of say, hey, let's screen for cancer.
Mm-hmm.
Lymphomas and leukemias are typically picked up best on a PET scan. So I've never done a PET scan in my entire life. Like I said earlier, I did a CAT scan in 2022 that came back unremarkable. The CAT scan didn't pick up the lymphoma.
Mm-hmm.
Now, is it possible that the lymphoma arise within 12 months? Yeah, it's possible, but typically cancer just doesn't flick on like that.
Mm-hmm.
It's something that is in your body, it's cycling through and, it slowly gets going. So I don't know. I mean, in my regard, I don't know why they missed it. There was signs there. I was telling them symptoms that I was having. If they knew about non-Hodgkin's lymphoma, maybe they would have thought, hey, maybe this is hand in hand what's happening. I think the bigger issue here is because if we take a step back and look at what's happening in the world with institutions and networks across the world, especially with insurance right now, the medical system is very stressed.
Yeah.
In all regards. The doctors are stressed. The hospital administration teams are stressed. The insurance companies are stressed. The nurses, the care teams are stressed. So you have a very stressful environment, and then you're putting in patients who are also adding to the stress. And the doctors are just trying to kind of be level-headed and make sure that stress stays low. or moderate. And I think they also have to be worried about liability and how they might discuss things or might assume things. And I think that's another large part in this is that we have a stress system, we have a liability issue where it makes things tough for doctors to kind of treat us or tell us how to operate because they could be sued or they could lose their license. And I think that's very scary to most. I think also the fact is that ego can get in the way. I mean, like I said, I questioned these doctors if it was cancer or not. And some of them would just look at me and be like, I've been doing this for 10 plus years. How are you going to tell me this is cancer? How would you know? Okay, I get what you're saying. That makes sense. I probably wouldn't know, but with my independent research and everything that I was able to gather data wise, I don't think it's a far-fetched guess that I think I might have cancer.
Were the
And
symptoms you experiencing, are they common symptoms of the lymphoma?
very common, Chase. Very, very common symptoms to the lymphoma.
Yeah, that's frustrating.
And listen, I'm not one to sit here and say that doctors want to keep you sick. That's not what I think is happening. So I don't want people to think that at all. I think what's really happening is just you have a system that's stressed. You have patients that don't know how to handle advocacy for themselves. They don't have a mind to body connection, which is super important in today's day and world. Um, and I think the system for medical teams across the country are stressed. I think insurance is stressed. I think that's why you're seeing such a big issue with insurance companies declining coverage for a lot of people who are going through it. Um, I'm currently dealing with an issue with my care team right now with an imaging process because they want me to go do a CAT scan right now. If we go back on this conversation that we've been having for the past 45 minutes, I just told you CAT scans can miss lymphoma. PET scans are the best thing for that. So why am I going to do a CAT scan? This is where I'm challenging the medical system and I'm being my own advocate. And I want others to start doing the same thing. Many people would just go in and meet with their first doctor and assume that that first doctor has their best interest in mind, which is true. That doctor probably does have your best interest in mind and wants the best for you. But every doctor is different with how they perceive treatment or perceive that person's ability to receive that kind of treatment. Um, Maybe that doctor has a different step to get to say conclusion, right? Every doctor is so different. Some are open minded, some are closed minded, some have egos that get in the way, and some are really like working with the patients to understand the patients. Like, hey, what are you sensitive to? What are you not sensitive to? What bothers you? What foods do you eat that really sit well with you? What foods do you eat that don't sit well with you? Do you see what I'm getting at here? Is more of like, it's not just, oh, go eat whatever after you do chemotherapy. It's, why don't you go home, make a nutritious meal like chicken, asparagus, potatoes, right? You have doctors who can get in depth like that. And then you have other doctors who kind of leave it vague and are like, after chemo, just go eat whatever. So I think people need to be understanding that doctors only know so much of either what they learned through their curriculum or through experience. And we, the human body and biology, are also different. There's no one path to, say, getting better. There could be multiple different paths to getting better. And that's just the human body being remarkable and working in different ways because we're all made up of different cells and we all have a different metabolic outlook on life.
Yeah. Well,
So
it's super unfortunate, like as you were saying, like most doctors, like obviously you're going to have people who don't care or people who are bad at their job in any profession, but most doctors are very caring and very good at their job. It's just unfortunate that the system that they're in doesn't allow them the time. Like it's like turning people through, like they have to get people through. They're only allotted 10, 15 minutes and then they're on to the next because there's a shortage of doctors. There's a broken system that keeps it, like you were saying, stressed. And it's really unfortunate. And the people who are sick suffer.
The people who are sick are the ones who are suffering from this. And everything that we're seeing right now in the world between the medical system, between politics, medical system, insurance, I'm sorry, I don't think politics and the medical system should be even somewhat put in the same realm. They shouldn't even be communicating with one another. And I think that's part of this issue that's happening in America today.
When you got your diagnosis, how long from that to when you started chemo?
So I got my diagnosis October 13th, so Friday the 13th of 2023.
Jeez.
And I was diagnosed that day, and I started treatment 1 month later on November 10th.
And so chemo is essentially you're poisoning your body in hopes to poison and kill off the cancer before you do so your body. Like, is that kind of a correct way to put it?
So yes, and I'm going to go into a little bit of detail here. So for other cancers outside of lymphomas, typically chemo will shrink the tumors and then you would go in and have surgery to remove them.
Okay.
With lymphomas, since they are in your lymph nodes, it's a little bit different. Your lymph nodes can swell up to be, say, 14 centimeters if they want to. Now, that's not a tumor. Your lymph node is literally it's a nodule in your body that helps with your immune system and helps traps diseases, illnesses, viruses, all of that. So the lymph nodule can grow to 14 centimeters, but that doesn't mean it's a tumor. Do you get what I'm saying? It's a big ball, but it's not like a hard tumor that you would have to get surgically removed. In some cases with lymphoma, you do, but most, I would say probably 80% of cases of lymphoma can be completely eradicated with chemotherapy, no radiation.
Really?
So that's a huge positive with where we've gone with treating lymphomas compared to other cancers. I mean, it's incredible, actually. When you actually think about it, we've completely eradicated a cancer with a chemo regimen. And that's awesome. Like, that is huge. People don't have to go through surgery anymore like they did 20 years ago for lymphoma. People don't have to get as much chemotherapy as they had to because immunotherapy got better. So we know the chemo works. We know it's, a great tool for lymphomas. But when it comes to other cancers, it's still hard right now because you can go through chemo and the hope is to shrink the tumor or to kind of get it smaller so that way the surgical team can go in and remove it without doing more harm to your body. So I think, for other cancers right now, it's a little tougher. But with lymphomas, if your body responds well to treatment, you're going to do really well and you're going to come out on the other side after 4 to 6 months and you're going to have eradicated diseases. The thing that I face with my subtype of non-Hodgkin's lymphoma is the chance of reoccurrence. I have a very aggressive type. It's, it can grow in a year if it wants to. It's very possible. But I'm praying that everything that I'm doing and everything that I've changed metabolically and cellular, it won't come back. But this is a part of that chemotherapy side effect realm. And that's the part that I think scares a lot of people, is that once you enter chemotherapy, you're damaging your body significantly. and you can end up with cancer from the chemotherapy. So,
Yeah,
there's a big risk with that.
it's a poison.
It's a poison.
So is that how long you were on it? 6 months, 4 months?
Yeah, I was on it for 8 months. I did 6 months of R-CHOP regimen chemotherapy, and then I went to a preventative methotrexate chemotherapy.
And how did your body respond? Like, obviously it helped, and but with the cancer, but how did you respond physically? Like, were you able to go to the gym? Did you lose muscle mass? How did you respond?
Yeah, unfortunately I wasn't able to go to the gym. I would have loved to,
Yeah.
but with cancer patients, our neutrophils and our immune system are very low. So we're very high risk to get sick. So I was kind of buckled up to home every single day and just locked into this house. So I had to get creative and kind of make a gym garage. I had to buy a pop-up sauna, and I had to really do things in the house. I did yoga here, I did meditation here, I worked out here, and I would do that typically 3 to 4 days a week, um, trying to just stay active and really flip that switch for my body. The other big thing was I want to use the sauna to detox everything that I'm going through chemotherapy wise. So I would go through chemo, and I would usually take 2 to 3 days to let the chemo do its thing in my body. And then I would jump in the sauna immediately after the third day and start detoxing everything out of me.
What kind
Because
of
I
sauna?
didn't want I didn't want those chemicals sitting in my body any longer than they had to be.
Were you in an infrared or traditional?
I just did a traditional. Yeah.
Okay.
And I honestly, it wouldn't get hotter than about 150, 160. And it was perfect for what I needed it to do. You know, the doctors were scared that I was going to get sick from my own sweat and my own bacteria and whatnot. But I told them, I was like, guys, I feel significantly better doing this than not doing it while going through treatment. And that same kind of thing happened with the marijuana edibles that I started taking. They were kind of taken back because they were like, the marijuana edibles could actually stop your T cell receptors from, say, fighting off any cancerous cells. Okay, I hear you, but I actually feel significantly better. I'm sleeping, I'm eating, I'm not getting nauseous, and I'm able to actually concentrate because of these edibles. So, you know, there was things that I was doing that maybe the doctors weren't aligned with or understanding of, but my care team was, supportive. They didn't say, no, we're not going to support you. Oh no, we're not going to treat you because you're doing this on top of our treatment. And that's what I really liked about my care team, because there was other care teams I met, and they were completely against, say, certain things. They wouldn't even be open-minded to it. I mean, there was one institution up in New York, Memorial Sloan Kettering, that I went to. They didn't want me getting a port in my chest because they think ports are worse, and they would rather you get an IV through your arm every time you want to go do chemotherapy. You're going to have no veins though, because the chemotherapy just burns your veins, and you know, it 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 hurts, it damages you. So having that as your injection site, I didn't want that. So there's certain things, certain institutions, certain doctors that are just stuck in, say, a certain way, and they're not going to change their ways for the patient.
Is there anything that you're doing now? Like you said, like, are you still doing sauna, or what are you doing now to help not get this resurgence and this reoccurrence?
Yeah, so everything that I'm doing now is currently metabolic and cellular. So I'm exercising 6 to 7 days a week, 3 to 4 days with cardio, 3 days at least of strength training. Um, I'm also I have an intermediate fasting diet, so I only eat one meal a day typically. as well as having 2 smoothies, one in the morning and one after my workout or one after my dinner meal. Um, I've realized we as humans are over consuming. I come from an obese family, and it's not a bad thing. We just overindulged as Italians. And I would say, growing up with that, that kind of set a bad precedent of what to do when you have food presented in front of you.
Yeah.
So I've learned that we overconsume. We don't need as much as we actually do even for energy purposes, y people think, "Oh, I need food for energy," and it's actually the opposite. So, I've been doing that for the past year and a half, and I really, really like it. I really like the results that I'm feeling, but I'm also doing red light therapy daily. I do that once every other week. I also do MHBOT, and I do that once a month.
Hmm.
And then I'm also using the sauna 5 to 7 times a week, and that is a given. Like, you have to have that in your regimen. I think everyone should be using a sauna in their life, and if you're not using a sauna, you're seriously missing out on its gains and everything it can do for you mentally.
I got
there's no
one
reason.
right
Go on.
there. I got one right
There
there.
you go. See, exactly. You got the sauna right there. I mean, it it's one of the best tools for recovery, for getting you into a very healthy place. I mean, even if you're not an athlete, even if you don't go to the gym and lift every day, you should be using the sauna. We are being exposed too much.
Yeah. Yeah, sauna's huge. I mean, Dr. Ronna Patrick talks about it. I've talked about it before on this podcast a lot. I mean, you're going to get increases in HGH, increases in immunity. You're going to get, mimics light cardio training. So you're going to get the effects of that as well. That aerobic capacity helps increase immune system, detoxification, like that goes on and on and on. And like the biggest studies out of Finland and the Finnish studies talk about how it's got a 40% decrease in all cause mortality. I mean, it's huge.
You're 100% right. I mean, the Finnish are the leaders of the sauna industry, and they've been doing it for over 100 years, and the results are just tremendous. I mean,
Mhm.
we know they work. We should be using them.
Are you still
There's
using a little pop-up tent one, or did you get like,
I still use a little pop-up one here and
eh,
there, but no, I typically go to Lifetime now and I hop in
okay.
the sauna. Typically, I actually like being in the sauna with the guys because then you get
Yeah,
to sit there and talk and,
for
you
sure.
know, BS, whatever.
Yeah. I got this one from Heavenly Heat. I like it a lot. The reason I kind of went with that is they don't use it's all put together with clips and nails. So there's no glues, there's no dyes in it. And it's
Okay.
got Faraday cages around it. So it's got no EMF and everything. It's pretty sweet. It's like the cleanest sauna that you can
It's
get
one of
right
the
now.
cleanest saunas
Yeah.
out there then, yeah.
Yeah. I
That's
love
pretty
it.
solid.
Yeah.
Do you use red light therapy or
I don't. I mean, red light panels are expensive.
they are expensive?
They're pretty expensive. So I could, but I know there is some new, like there's some benefits to that. Absolutely. What red light panel did you get? Is like their brand that you recommend, and how do
I
you
actually
utilize it?
recommend Mito. I recommend Mito Red Light for their red light panels. They're great. I've used them in a few different places like Restore Hyper Wellness. I don't know if you've ever
Mm-hmm.
heard of them, but they're
Yep.
across the country focusing on just restore, recovery, wellness, all of that. So they have like cryo, MHBot, red light saunas, infrared. And yeah, they have great panels. I also have a portable Mito red light. I use that frequently. I mean, Chase, you have great skin, so I don't even know if you need it, but I mean, that's how I'm staying so young.
Yeah. My wife, yeah, I'm gonna clip that and send that over to her because she's always telling me I need to do skincare, which I do not do. So with the red light, how long do you stand in front
Red
of it?
light, I'm typically doing 15 to 20 minutes at most. And I would recommend if anyone's dealing with, like, say, knee cartilage pain or any kind of cartilage pain in their joints, use a red light therapy. It's going to help tremendously with your cellular and mitochondrial health.
Interesting. That's cool. How much are like? I know they make like the big full wall panels or just like the small little. Like, what do you have?
I've got a little portable mini, and that
Okay.
guy runs $300, and
Okay.
then they make panels that get upwards of 4,000.
Yeah,
It
they're
just depends
crazy.
what you want.
Yeah. This Heavenly Heat sauna brand, I just got like a small little 1-person one just so it could fit in like this office, but they make like a 2-person one with a built-in red light panel, so you can like get that while you're in the sauna. It's pretty cool.
That's pretty nice. That's
Yeah.
pretty nice. Have you I mean, I know you talked to Eric on the podcast and whatnot,
Mhm.
but did he talk about, like, Sisu sauna or anything along those lines?
I went over to Muscle Mountain. I went over to his place and I got in the Sisu. It was sweet.
Okay, nice.
They're
Very nice.
super nice looking. Really cool. It's a traditional. He was ripping it. It was hot in there.
I was gonna say he's definitely ripping it.
Yeah, yeah. It was really hot, and I wasn't as heated after because I hadn't got my sauna yet. I finally got this just like a couple months ago, so I've been using it, so I get more heat adapted. So I was getting cooked.
Okay. So what is your sauna getting to right now?
So this is an infrared. So I'll turn it on whenever I want to do it. It takes about 30 minutes to get up to about the temperature that I want, that I want to get in. So I usually get it around 140. And then by the time I get out, it's usually topping out at like 165, but it can go up to like 180.
Solid,
Um,
okay. Yeah, I mean, if you 180 is, like, the marker of where you wanna be constantly for best prime results of a sauna. Anything
yeah,
over 180, I mean, there it's great, but, like, then you're pushing
yeah,
dehydration and
yeah.
salt loss and all that.
For sure. And it's interesting, like being that it is infrared, like the way it heats you versus a traditional sauna is different. And it like if I get in and I put it to 180 and I get in and it's sitting at 180, it's hot, obviously, and I'm starting to sweat, but I don't sweat nearly as much as I do when I get in at 140 and it rides up because it'll turn off its
Kinda
heaters in the
heats you up
infrared.
from inside out.
Exactly.
Yeah.
Yeah. So if I get in at its top, like where I put it, like the heaters will turn off and the infrared will turn off versus like if I get in while it's still going, I'll be subjected to those the whole time.
Okay. Are you using the sauna at the gym at all too?
No.
No?
None of the gyms I go to have like I don't go to like I just go to like a CrossFit gym or Olympic, so they don't really have a
Got it.
sauna.
I
Yeah.
I had to ask because, like, honestly, I mean, I'm going in there 5 to 7 times a week, and that's where I'm making community is in the
Yeah,
sauna,
for sure.
and I'm realizing too, just I have a lot of young guys, and you might even get more young guys watching this podcast on YouTube. There's a lot of young guys that I'm working with and I'm meeting constantly and daily that are looking to guys like, say, you, me, and other people in the world who can kind of be a mentor or a coach to them because they don't have, say, someone around them that can motivate or create that drive for
Mm.
them to that next step in life. And I'm talking 20 to 25-year-olds I'm noticing this with. And I think what we should really try to get across to these young guys is that they are facing adversity of different kinds, especially in the world today with where it's going. I notice it even with college students. They're being very pressured um, into all aspects of life. They are very stressed. We can look at the data rates of depression and anxiety between all levels of ages, and it's only rising. So, what's going on there? Why are all these young guys uh, kind of out of the loop, and why are they losing their drive and their motivation? You know, what's the larger picture here? And I think it goes back to say like social media, playing victim, finding an excuse to make it easier for yourself to say this is why I can't do something or this is why I don't want to go do it. And I noticed these guys who are, you know, they're looking and trying to find people who will support them or mentor them or coach them. And I hope these young guys understand that there's going to be challenges, like I said earlier, and you're going to have to face them head on. And there's no running away from it. So why not start challenging yourself now, personally, on purpose, rather than waiting for a challenge to arise and not knowing how to face it.
The saying, like, the hardest thing you've ever done is the hardest thing you've ever done. So for somebody who sits on the couch all day, hardest thing they've ever done is, they have to walk down the street to do whatever or whatever that is. But for them, that is the hardest thing they've ever done. And they have that mentality. It's like, oh, I have to go do this. It's going to be so difficult. Let me go do it. Versus if you do an Ironman, if you do a 50 mile, if you do a 100 mile, or if you do something truly difficult, your bar for difficulty is raised and everything else becomes significantly easier. So
100%.
like the need to implement self-imposed hardship is so important. Like it focuses the rest of your life, the rest of your day, your career, whatever you're doing outside of that self-imposed physical hardship is made so much easier when you have that. The goal is not to find the easiest life and the simplest life. The goal is to have the challenges that you want to face, that you choose. That way everything else is manageable.
I 100% agree with that. It's also, it's more so just the fact that if you challenge yourself now and you push yourself to do hard stuff now, you're not going to crumble when that problem does arise. You're going to understand how to overcome it. You're going to have different ways that you might have to get to the solution. I mean, whether it's financial hardships, family issues, health, I mean, it could be whatever, career. There's going to be problems for these people in their life, and there's going to be challenges, and you can either get stuck in a hole or you can try to pull yourself out of it. And I think that's the biggest thing here is that people get stuck in a hole and they don't even try to climb out of it.
Mm-hmm. Absolutely. And what's unfortunate is as you lean in the direction, like if you quit something, you quit more things and it becomes easier to quit, and you develop the characteristics and the habits of a quitter. Versus if you do challenging things and you don't quit, you develop the hardship and you develop the mentality and the ability to persevere and to.
I could bring up a perfect example right now. I mean, like, just imagine going back to high school football, right?
Mm-hmm.
And they're making you do sprints or mountain climbers, just things that are like outrageous. After a 3-hour practice, you're like, I don't want to do this, and you kind of just like are like the stubborn guy on the sidelines who
Mm-hmm.
just isn't doing it, and the whole rest of the team is doing it. And like all that does is that builds up a victim and excuse mentality for you. And now I'm going to get into this really quick. I think the biggest thing here is if you start challenging yourself now and doing hard things now, you might not have to face hard challenges later on in life like Craig did. If you start capitalizing on your health rather than say, oh, I'm young, I have time, I'm going to wait, because that's what I did. I was living a life in between prior to disease. I was not having the best diet. I partially exercised. I really was chasing girls. I was focused on the wrong things, Chase. I wasn't just focused on sports and diet and nutrition prior to my diagnosis. I had a different lifestyle prior, and I got to be honest, I wish I capitalized on my health more prior. And I was doing that, but I lost sight with it. And I guess that's so much the thing with younger people now. It's easy to lose sight. You got to stay disciplined and locked in almost.
Absolutely. Is there now that you finished your second 70.3, is there a next misogi, a next challenge, if you will?
I think the next, I have a Marine Corps marathon on October 26th, so I'm doing my first marathon ever.
Nice.
I'm a little worried because I'm dealing with minor shin splints right now, but I feel pretty confident that we'll get it done. I'm just trying to get it done in under 4 hours and 30
Nice.
minutes so I can qualify for Boston.
Oh, huge. Wait, what is the qualifying time?
You got to get in 4 hours, 30 minutes?
For Boston? I'm pretty sure it's quite a bit quicker.
Is it?
Yeah, because my wife qualified for Boston. She's going in 2026. We have it marked up on the calendar.
Do you?
And, yeah. And
I could have sworn it was like 4:24 or 4:30 in between there.
For females, I think for females it's like low threes, and then males it's faster.
Oh man, I could have sworn I saw something the other day, but I might have been wrong.
Boston qualifying time. So, what is men's qualifying time? So yeah, men. I assume. How old are you, Craig?
I'm 31.
Okay. Men expected cutoff time is 3 hours and 5 minutes. Females.
Oh Jesus, yeah, no, I'm not making that. So I'm shooting for 3 hours and 45 minutes. But
that's
huge.
That's
it for me.
Well, the longest I've ever ran is when I did my Ironman, the 13.1 miles at the end. And then I'm going ahead and just skipping the marathon. And I have a 50-mile ultra marathon October 17th.
God bless you. Where are you doing that?
I'm doing that in Utah with my sister Davis. Yeah.
That's amazing.
Yeah.
That's
so that
amazing.
it's Friday the 17th. So little less than 2 weeks away. And, I'm shooting for like sub 12 hours. That's what I want.
That's amazing though, Chase. And what's the elevation over there?
So I'm in Colorado, so I'm at right around 5,500. So I think in elevation, Salt Lake City. So Salt Lake City's at 4,300 feet. So it'll probably be around 39 or 38 where I'm running it. So
that's pretty tough elevation too.
It'll be fun. It'll be a good time.
You got this. You'll be fine. Honestly, this is all mental.
Yeah, 100%.
This is all mental.
This is kind of where I'm starting to, as it gets a little bit closer and I'm running and I'm training for it, I'm like, oh, 50 miles is a lot. That's a long ways. So it's going to be fun.
When you're in the zone and you're running, right? We talked about this, like, what are you using as your drive? Like, what are you using when you're training out there alone? Because being in an Ironman, being around thousands of other people that are doing the same thing and kind of have that same drive to finish is momentum.
Yeah.
But when you're training on your own, all you have is you and your thoughts.
Yeah. I mean, when I'm training on my own, I'm really not thinking about much, honestly. Like I have a history of competitive training and training for fitness. Like I used to try like compete in CrossFit. And so anything I'm doing in terms of acute pain is nowhere near as hard as what I was doing back then. Now it's just over long distances. I'm not as uncomfortable as I used to be, but I'm more uncomfortable for a longer amount of time. And so it's really just kind of, because when you're running, it's like when I was doing that Ironman, when I'm going to be doing this, it's like you get uncomfortable relatively quickly, but it doesn't ever get worse. Like you're just uncomfortable. And so it's just like, okay, how long can I withstand this discomfort? So whenever I'm like starting to get annoyed about something or like I'm tired with it, it's like, okay, I do it like a self check. I'm like, how are you feeling? Like, well, I'm uncomfortable when I'm not in pain. Like things aren't like, I'm not dying, like things are fine. And then it's like, okay, so can you maintain this level of discomfort? And you're like, yeah, I can. And then you just keep going. And so we'll see how that lasts with the 50 miler, but I there's no part of like, I know I'm going to finish. Like that's not a question. It's just,
what's the fuel for this race?
So I'm trying to do a difficult thing every single month. So I did the Ironman. I'm doing this for October. I think I have like a 24 hour race in November, and then I'll find something for December. Honestly, there's no fuel outside of accolades or finishing or anything like that. I think my only fuel is just building that self-confidence. Like that quote from Alex Ramosi is like, you don't build self-confidence by shouting affirmations in the mirror. You build self-confidence by outworking your self-doubt, by building undeniable proof that you are who you say you are. And so for me, even though I've been very fit in my life, even though I've done a lot of hard things, I always feel like a failure or a quitter in some degree, because even if I do something really, really good, in the back of my mind is always like, okay, you could have gone harder. Like you could have gone 1 second faster. You could have done that. And so there's a lack of there's a lack of appreciation for myself and what I do. And so now when I'm doing these challenges, is there's not an expectation on how fast or how well you can do it. It's just appreciating what I'm doing and enjoying the moment and doing something hard and being content with my performances in those things.
I love that. I love that.
Yeah.
And I think that makes sense completely. Do you feel like that hinders you or kind of drives you to do more? Because like I feel like some people that would like hinder, they'd be
Yeah.
like beating themselves up too much.
Yeah.
Whereas other people that might be the driver.
It's definitely, as I'm getting older, I'm 28. It's definitely hindered me in the past, because like I will burn out and I will never feel good with what I'm doing. So like when I was training for CrossFit, it was wake up, I have to eat. It's like, oh, I'm sitting down, scrolling my phone, I'm skirting down, watching TV. I should be stretching. I should be mobilizing. I need to go to the gym. I can't waste time doing this. I can't hang out with friends. Everything has to be regimented, because if I'm wasting time, then I'm not doing everything as well as I could be. And if I'm not doing as well as I could be, I might as well just not do it at all. And
That makes
so
sense.
that leads to a heavy, heavy burnout mentality after a while. And so now it's kind of finding that ebb and flow. Like, okay, this is what you want to do it well, but you need to save time for your wife. You need to save time for yourself. And it's okay to make those choices, because you that's just where you are in life. And so just finding that ability to accept where I am and accept that it's okay to not want to do the things and not do the things all the time. Like you can make other decisions.
Absolutely. So, question for you, because I mean, being that we're both in Ironman training and we're both
Mm-hmm.
sacrificing a lot of our time towards this, um, do you feel like it stripped you away from anything in life? Do you feel like you've gained more in life?
Yeah.
Because for me, people are like, how do you do the same thing over and over every day? And I explain to them, like, this is what's making me happy.
Yeah, absolutely. Um, I've never been somebody who stays up late, who goes out, does that thing. I've always been very regimented with my sleep and with my nutrition and with some degree of fitness. Being that my wife's in medical school, she's super busy, so she's studying, so I need something to fill that gap. And so it's either I can fill it with something beneficial and physical and something that pushes me, or I can fill it with something else that's just kills time. And so I don't feel like I'm missing out on anything. I'm enjoying it. I have the benefit of having all my best friends, which are my siblings, all doing it too. So we're always pushing each other, or signing up for something or doing something else. So I'm having a blast.
That's amazing. Honestly, that's amazing. Yeah, I can't actually relate to that. Like, I don't really have many drivers, friend wise, or even family wise, for
Mhm.
that matter. I I got to be honest. Most of my friends are not into this lifestyle at all. Not a bad thing. They're just not into beating themselves up, I guess.
Yeah. They're
Not
and
sure.
the
But,
majority.
yeah, my family, like I said, they don't really come from the athletic background. They're Italians. They like to eat. They like to have fun. They like to
Mhm.
BS and whatnot. Um, so, I didn't really have any of those drivers in my life around me to even get me into this mode. It was kind of more just like self drive and like pull that from inside. Um, and I hope others, because for me, like my sister, she's 10 years older. We don't really have the best relationship. Um, you know, I hope others understand that you don't need mom or dad's permission. You don't need your siblings' permission. You don't need your friends' permission to go out there and try something hard or different. And if you do those things, that person or people aren't going to be mad at you for it. They might look at you differently for it, but at the end of the day, if that's what's stopping you from putting yourself out there and trying something, that's that's a silly excuse.
Yeah,
You're the
absolutely.
only one you're stopping is yourself.
And you're missing out on something great, or could be great. Like you
Or
don't
it
know
could
what
be great. You don't even
yeah.
know if you love it.
Yeah, you don't know what you don't know at that point. I never thought
Exactly.
I'd enjoy an Ironman, but I had a blast. Are you going to sign up for a full, or have you done a full?
I am going to sign up for a full. I've never done one. I
Yeah.
am really looking forward to it. I would say the 2.4 mile swim really scares me.
Hmm.
Like, really scares me.
Yeah.
Being in the water that long. But
Yeah.
outside of that, I mean, I love biking. I love running. So yeah, I'm looking forward to it.
Have
What?
you picked one out yet?
No, I have not. Have you?
And I have not picked one out. I need to find one that works with all of my siblings' schedules so we can, because I'm sure we'll all do it. We were talking the record for Ironman for family members to do one race is 6. And we were at 5 because there's 5
Oh,
of us.
wow.
So we're gonna try and break that and have the Ironman record for the most family members in one race.
That would be pretty sick.
Yeah. So we're gonna try and
That'd
do
be
that.
pretty sick. Have now, question for you: Did like were your parents like into this sport? Was anyone into triathloning
Nope.
prior to you and your siblings?
Nope. No. Yeah. So we all had to figure it out. That was kind of we went from nothing to the 70.3 in 3 months. Nobody knew anything about it. We all just YouTube videoed and found Facebook groups and figured it out.
That's awesome.
Yeah. What
That's
about you?
actually awesome.
Did you know anybody?
So yeah, I actually got a few friends from back home in Mamaroneck, New York. Bobby Cox, who you might know on Instagram,
Uh-huh.
and then this guy Matt Roberts, who both are from my hometown. We are about 5 years apart. One is older, one is younger. We're all in the same age range, but they actually jumped into it early on. So Matt being older, he jumped into it years ago, and Bobby actually saw him doing it and reached out to be kind of his mentor and coach on it. And Bobby jumped into it a few years ago and did a full right off the start of it. He didn't even
Yeah.
start with a 70.3. He just went for the full. And he did really well. And yeah, and then him and his brother started getting into it. So his younger brother started, bringing more attention to the hometown, and younger people in the hometown started to see what it was.
Mhm.
In my high school, we never had triathlon offered to us. That wasn't a thing. And I don't think anyone in my high school at that point really even thought about triathloning. That was seriously, it was like kind of unheard of. It was a foreign sport to us. And I mean, as soon as I was in the hospital in 2024, I saw Bobby post something about Ironmans, and that was my trigger right there to be like, if Matt can do it, if Bobby can do it, I can do it, and show everyone that I'm coming out of chemotherapy doing an Ironman as
Yeah.
well. So, I mean, like them doing it, that was my motivation and drive. So, yeah, that was kind of the start trigger for me to like get off my ass and get out of the hospital and get going.
That's awesome, man. And
Yeah.
it's so fun. Like the atmosphere at an Ironman is unlike anything else that I've ever been at. Like everybody is just so hyped and having so much fun to be there, even though it sucks and everybody's miserable when you're actually
The
doing
energy at 5 in the morning is incredible.
Oh,
I mean,
yeah.
these people are coming off like 4 hours of sleep, some of these guys, and they're just like the level of energy they have, you'd think they'd be like working the event.
Yeah,
Or
it's
like,
insane.
yeah.
The rest of my Ironman experience is probably going to be tainted by how good my first one was. Simply like in terms of our living situation, so it was in Santa Cruz. We got an Airbnb that was literally like 100 feet from the start line. So we just
That's insane.
got out of bed and walked right out.
You just
over
literally
there.
walked over.
Yeah, it was amazing, and it was like right in next to the transition venue as well. So like all of our family and friends there could go back to the Airbnb and eat and then come back. It was like literally the perfect spot.
That's awesome. By the way, how was the course for Santa Cruz? And like, would you do it again?
Yeah, absolutely. It was super fun. I mean, obviously I don't have anything to compare it to, but The swim, you go around the pier. So you just start on one side, go out, and then over, and then back in. There was a long transition. So like from the swim to the trend to get to the bike transition was like over a quarter mile, like closer to half a mile of, and so you're like running on like sidewalk barefoot, and then to get over to that. So there was a longer transition, but the bike you're on the coastline. So you're just riding along the coastline the entire time. It was sick. And then
that's pretty sick.
Same coastline run. It was
Was it windy?
Really, no, it was beautiful. It was perfect.
Awesome.
Yeah. It was perfect. The only thing is like miles like 6 and 7, like 2.5 miles of the run, you're kind of at like a running on sand, like a packed and looser sand section on a bluff, and that was like miserable because it was like super hot.
That probably tears up your shins and all that.
Yeah, but other than that, it was awesome course. I would absolutely go back there.
Nice. Chase, what are you doing for like, I guess, more nutrition?
Yeah.
Base. Like, what's your nutrition looking like?
So I usually eat 2 meals a day with one snack in between, usually 2 big meals. I eat a lot more quote unquote animal based. Now that I'm doing a lot more endurance, I'm adding in a lot more carbs in the form of like oatmeal and things like that. But I eat a lot of eggs, red meat, chicken, fruits, and then vegetables as well, dairy products. So I usually wake up, have training, and then have a big meal. And then about 4 or 5 hours later, I'll usually have like a protein drink, which I use a Quip protein, which is like beef protein with like creatine and salt in there. And then I'll have like an RX bar just for some fats and carbs. And then I'll have another meal around like 4 p.m. And so I try to be done eating pretty early because I notice it affects my sleep.
Nice. Yeah, I was gonna say, I like for me, I'm noticing eating anything after 8 p.m., my body just struggles to digest. Interesting that you're eating oats right now. Question for you: does glyphosate not like worry you at all with oats?
Well, you can get, so there's what's this? Is it called Sprouted? I don't know. There's a brand.
You have a specific brand you're finding that isn't sprayed. Okay.
Yeah,
that's what I was getting at.
Yeah. I mean, it's hard. Like if you want to nitpick everything, you can have a very difficult time.
Very difficult time.
So for me, I try to just prioritize the things that I want to do. So I just try to get like clean meats, and I don't eat processed foods. I store things in glass containers. My kitchen is about as clean as it gets. Like they're all stainless steel, cast iron. Like it's a pretty good spot to be.
You're living the non-toxic life, basically. Yeah.
Basically, yeah. It's pretty clean in there.
And I think that's the lifestyle most of us in this community are choosing to live, because we see the benefits of it. My diet's pretty simple. It's pretty bland, I'll be honest. I do 2 smoothies a day. So it's 1 smoothie in the morning, which is typically blueberries, bananas, vegan protein, greens powder, mushrooms. So I use cordyceps and lion's mane, creatine monohydrate, just about 0.25. I won't do 0.5. I'll do 0.25. So I actually scale it back from the recommended dose. And then I also
you go 2.5 grams of creatine.
Yeah.
Okay.
Yeah. I scale it back just because my body went through chemotherapy, my liver, my kidney took a beating, and creatine it's a little hard to process and get out of your body properly. It can also strain the kidneys big time. We know that. But I also use turmeric as anti-inflammation and curcumin. It's great. I probably would suggest everyone to be using turmeric since it's just a natural herb and it's great for anti-inflammation and bloating. But that's pretty much it for the smoothie. And I use lactate milk because dairy, I think, is inflaming most people's bowels unless you're getting like raw milk. That's really good. And I think most milks these days are just processed.
Yeah, for sure.
They're just filled with additives and whatever else, preservatives that they decide to put in it. And yeah, I just noticed that it's maybe not just a lactose problem, it's rather just a sensitivity issue.
It's funny that so I actually ramp my creatine up. I usually take about 5 to 12 grams a day. Plus, I eat a lot of red
Okay.
meat, which is naturally carrying. Any
Naturally
skeletal
carrying
meat
it.
is going to have creatine. So I scale that up. Particularly, I mean, but I break that into 2 doses. So I have about 5 to 6 grams in the morning, and then I'll have another 5 to 6 grams in the afternoon. What I've noticed when I do have that extra dosage of creatine, I don't get an afternoon lull nearly as much as I used to. So like I stay sharp, I stay ready, like I don't feel
Ready
as
to go.
tired. Yeah.
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 That I will say I noticed since I started using it's been about 5 or 6 years since I
Uh-huh.
started using creatine again, and I mean, the results, just the difference in how I felt. I could see it, I could notice it. From 5 to 6 years ago, I was a lot more fatigued.
Hmm.
Things would just I I I would get tired easier doing certain tasks. Um, so yeah, I mean, creatine, I think, is something that a lot of people should be using if they can.
Yeah.
Yeah.
Elderly, everybody. There's a new study that came out about megadosing creatine, like 40 grams for the brain effects.
That's insane. I probably won't partake in that, but I'm sure people are doing it
Yeah. Uh, Not even for like not for any like physical benefits, but for the cognitive benefits
for
apparently.
the
So
cognitive.
yeah.
Yeah.
So
Yeah. I
it's
mean,
it's
we know it works.
yeah. I
Like,
mean,
why not take it?
that's the fun thing is like there's different strokes for different folks, right? Like people can find something and make it work. Like you have what Brian Johnson, um, don't die,
Yeah,
his whole
don't
thing,
die. And he's
and
like,
he's doing it vegan. He's doing it, and then you have other people who are trying to do it carnivore, and you have everybody in between. And so it's really interesting. I think we're in an exciting time where people are starting to take food and nutrition a little bit more seriously and a little bit more stringent with like the research. So hopefully we can see some more exciting things down the
you
line.
just nailed that on the top of the head. I mean, it's all coming back to independent research and being your own advocate at the end of the day. Like, it, you need to find what works for you at the end of the
Mm-hmm.
day, right? Because Brian Johnson's way might work for you, but it might not work for me.
Mm-hmm.
So, I mean, this is where you really need to kind of be like trialing and error with like life right now and diet and nutrition and what might work for your body, right? Some certain supplement might work for me, but you might have an adverse reaction to it.
Mm-hmm.
It's just the way it goes. And it's no different though than say the medical field, right? The doctor's coming in, hey, I really want to give you this medicine because it works and we have the data on it, but that person might have adverse reactions to it and die.
Yeah. Yeah.
It's no different, right? I
Mm-mm.
mean, it's the exact same concept. It's just sad that we see a lot of people bash the health and wellness industry because they might not have, say, certain degree in that field. And just
Mm-hmm.
because that person doesn't have a certain degree in the field doesn't mean that they're wrong.
Yep. My biggest thing that I'm trying to do right now is I'm very okay eating the same thing every day. Like I'm very okay just like and making it like super simple, like fats, protein, carbs, and looking at it that way and just like eating it. Like that's fine for me.
You're not tracking like your macros. You're not like, oh, I hit
I-
180 grams of protein today.
but also I don't need to make it like a tasty, like in terms of like I don't need to like mix it up and make it spices. My wife is not that way, and so I am having to cook things and make them because I enjoy cooking and I do the cooking. So I'm having to make meals now instead of like just eating and looking at it as like, okay, this is fuel. So that's been fun recently is like trying to make the food that I want to eat, but make it more appetizing and make it more like a meal for her as well.
That's I mean, and that's what people should be doing rather
Yeah,
than eating out or going to these restaurants, and
for
they
sure.
should be at home with their wives or with their significant other, making dinners and making it fun, and I'm a big person to push that. Um, I you'll never really catch me out at a restaurant on unless I'm, like, traveling or I'm there for a special event. I'm not typically going out, and it's not because I'm boring or I don't wanna go out.
Yeah.
It's that I genuinely like making my own meals and eating my own food and having my own nutritional, uh, input.
Yep. When my wife and I do go out, we cook 99.9% of our meals and eat at home. But when we do go out, it's usually to like a really nice restaurant where it's like we want to try something like exciting, like a really
extravagant, fancy,
yeah,
like, right? Like you're going to do it up because you don't really do it that much. And you know, you're
exactly.
also going to get good food.
Exactly. Yeah. There's being in Denver, so I moved here from Salt Lake. Salt Lake doesn't have any Michelin star restaurants, but Denver's rocking a couple. So that's probably going to be our next going out to East, trying one
I
out.
didn't know that Salt Lake didn't have any Michelin star restaurants, because when I ate in Salt Lake in 2024, I stopped at some steakhouse there, and it was in main downtown area. Me and my buddy, we sat outside, and it was
Was it good?
fire, amazing. Yeah, it was so good. I mean, like, I don't know if it was Michelin star or not, but like I would have maybe assumed it could have had one. But now that you just told me that Salt Lake City has no Michelin star restaurants, why is that?
It's not a food hub. It's not known for the food out there. There's some good ones up in Park City, but yeah, I'm pretty sure it doesn't have any Michelin star restaurants at all. Nothing pops up on the guide.
Interesting.
Well, Craig, I do have a tradition on this podcast where I ask the guest if they had a podcast or was interested in talking to somebody, who would that person be? Who would the person be that you are most interested in speaking with? And assuming they're alive and well, I will try to get them on this podcast.
I think you should really. This is tough. This is tough. You put me in a tough pickle here, because I have a lot of people that like I'm really infatuated by. But someone who's like inspirational, who brings different vibes, who can really bring out say that drive for people to be different and to really be the champion of their own life, right? I would tell you, I would really love to talk to Samuel Richards, and I think he's great. I think you would really like him and get along with him. His story is incredible. He is the champion of his own story. He's been through a lot, and he continues to go through a lot while trying to drive and pave home what people should be doing. He kind of has a David Goggins mentality, right? You can't break it unless like he's 6 feet under, and he's not going to change. He's not going to stop. He's just going to keep going. And I think that's someone you can talk to and really look at to exemplify what strength means and what it means to own your story.
That sounds like somebody I'd absolutely want to talk to. Samuel Richards?
Samuel Richards.
Write that down. Yeah, I'll definitely reach out to him. Well, Craig, this has been an absolute pleasure,
thank
man.
You.
Hey,
I appreciate it.
Let's find a race. And
I was
I'll
actually just about to say, if you're going to talk to your siblings and whatnot, I might actually come join you on a full. Just let me know what you're going to do.
Yeah, absolutely. We'll find a time that works, and we'll run it by you. Any particular states or parts of the country you're trying to look towards?
I'm open-minded, Chase. I'm very
me too.
flexible. Listen, I'm single, so I I don't have anyone holding me down or holding me back. So just keep me posted, keep me in the loop.
All right, man, will do.
All right, Chase. Thank you.
Friends, welcome back to the show. I wanted to take a few moments and speak no script, and we'll see where it goes. I just wanted to give a sincere thank you to each and every one of you that listens to the show. I know you could be using that time to do anything else, and I'm very conscious and protective of that time, and I'm always looking for ways to add more value through things like production, as well as through myself as a podcast host. And I'm at the point where I feel like I'm just getting started. I promise to continue to work each and every week to add more value and get you guys more return on that time. And my only ask is that you take a moment to go ahead and hit the follow or subscribe button that's right here on this app. It helps tremendously in allowing more people to find the show. And in turn, that allows me to get the guests that you guys want me to speak to. Thank you so much.